Welcome to the Voice of Nursing. My name is Adrian Tracy. I'm the CEO of ICG Medical. Today we are joined by a lead specialist nurse in Stoma Care, Tracey Virgin-Elliston. Welcome, Tracey.
Welcome, thank you.
Thank you for coming along. Tracey, give us a bit of background about yourself and how you got into nursing.
I don't think I always wanted to be a nurse. When I was thinking about that coming here today, my father had an out-of-hospital cardiac arrest when I was 9 years old, and never came home, and the police knocked at on the door, and that was kind of the end of that relationship. So I think going back all those years, it was the nurturing I received at a very difficult time and seeing my mum suffering that probably made me think that I wanted to become a nurse and I wanted to make a difference in people's lives. So I was born and brought up in Pimlico, and I applied, once I'd finished my A-levels, I applied to all of my local schools of nursing and got accepted actually by Westminster Hospital, St Thomas's Hospital, and all of the leading hospitals around. But the lead time then for starting the course was over 2 years, and I was unsure as to what I would do with that time. So my mum, who was working at the Department of Health at the time, actually recommended that I train at the West Middlesex Hospital, and I went off and had an interview and was lucky to start my nurse training in those very old ways where you trained for the first 8 weeks within the School of Nursing on dummies and learning practical skills before you were let loose on the wards. But it was an amazing training and a fantastic foundation for a career that will be 40 years next year.
Very good. And so you started off on the wards?
Yeah, I did. I started off once I'd qualified. You know, in those days, actually, there weren't loads of jobs around, and it was about where a nursing officer had highlighted they'd like you to come back and work, or where you had a kind of interest. And my first job was on a burns and plastic surgical unit, and it was a very supportive area because everybody was qualified. It was so specialised that all of the nursing teams were qualified, and we were looking after severely disfigured patients from bad burns, where we were doing lots of skin graft surgery, but we also did plastic surgery where we were doing breast reconstructions. And I found it a fascinating role with really good leadership from the team that were there. And I felt that I needed to get some more training, so I did a postgraduate course in burns and plastic surgery, a burns unit in East Grinstead, which is where they pioneered plastic surgery in the First World War. And the more I looked into it and the more I did, I realised that I was interested in altered body image and patient sexuality and how they were able to manage those things when they'd been through an illness or something that changed their perception. And I came back and worked on the unit, and at that time, back in the 80s, we were also doing gender reassignment surgery, and we had a surgeon that was doing female to male gender reassignment surgery, which was quite revolutionary in the day. So I went off and did a secondment at the Gender Identity Clinic at Charing Cross, and came back with new vigour, with what I felt were the ability to be able to support these patients. But it soon became clear that the kind of sexuality element was lacking in my knowledge, so I was allowed to go away and do a year's psychosexual medicine course for nurses at Lewisham, which really helped me understand people's sexual identity and how we use that in our daily life and how we feel when there's something about us that is flawed. I worked on that burns and plastic surgical unit for a long time, but then felt I was ready then to move up within my nursing career. So a post for a junior sister became available on a female surgical ward, and again that was a really sort of lovely time in my career where I was supported by the senior sister. I felt like I'd finally reached that pinnacle where I'd got that ward sister's frilly cap in those days. But it brought more challenges, as it always does. I was looking after patients that were having mastectomies. I was looking after patients that were having stomas. And although that tied in with the body image and sexuality stuff that I was good at, I really felt I lacked the basic foundation knowledge, and I really loved looking after stoma patients and all of the kind of problems and adversity that brings for them. So I went off and did a cancer course at the Marsden, and I did a stoma care course as well.
And just for people who maybe don't understand what stoma care is, could you make us a bit of a breakdown about what it is?
So when somebody has a debilitating bowel disease, such as ulcerative colitis or Crohn's disease, or when they have a cancer of the bowel, sometimes there is no alternative, but when you have surgery you need to have a diversion of your bowel or sometimes your bladder. And that diversion is a piece of the bowel that's brought out onto the surface of the abdomen, of the tummy, and it is either a temporary or permanent diversion for your waste, so mostly for your fecal waste, for your bowel waste, or sometimes if there's bladder issues for urine. And of course, it's not a normal way for us to void, and it's one of those things that people are really scared. They've either heard about colostomies, or they know somebody from days gone by, and they just feel that their life is going to end. So I did that course, and then I took over a colorectal ward. So I became a senior sister on a colorectal ward, and that really was one of my most favourite jobs. Unfortunately, after I'd been there probably 2 years, they decided they were going to change it into a vascular ward. And for me, vascular was too much of a chronic condition, and I really like to see the difference I can make when it's happening. And I felt, I've never really, I don't feel it's my sort of forte when there's a chronic medical condition. So I was looking at how I could develop my nursing career. There weren't nurse specialists in the UK back then in the sort of 80s. And the role was just about developed in the United States, and it was coming over. So we did have stoma care nurses. Stoma care nurses worked, but not as true nurse specialists in those days. And I made a point of looking into this and going to see the kind of head person at the hospital. They weren't CEOs in those days, but actually to say we need to develop the role of the nurse specialist. It's a good career pathway for nursing, and I would like to be your first nurse specialist, and I'd like to be the stoma care nurse specialist. We did at the time have a community nurse specialist, stoma care nurse. And it took a while, but eventually the role was developed, and I've been a stoma care nurse specialist for many years. And some people, particularly my boss, doesn't really understand why I've stayed within it, but it's such a rewarding career role that also allows me to go off and do project work, but also allows me that work-life balance that is also really important within any career.
You're an award-winning stoma nurse, I understand?
Yes. So 2 years ago now, I was named Stoma Care Nurse of the Year by the Association of Stoma Care Nurses, which was lovely. And that same year, I actually came second in the British Journal of Nursing Stoma Care Nursing Awards. The stoma care nurse that beat me then had just been given an OBE. So actually, that was fairly justified. So no, it's lovely, and it's a really humbling position to be in. Even after all these years of doing the job, it was very lovely to be recognised and acknowledged for that work.
And I know you do some lecturing, and I know we've mentioned about your surname.
Yeah, so I was always Tracey Virgin, and of course because I've always taught on the stoma care courses, originally at Barts when the old EMB 216 course was done, and then latterly for a number of either companies running courses or stoma care courses, everybody knew me as Tracey Virgin, and it made kind of quite a lot of amusement. So when I married, I just added my husband's name on the end. It was partly ego, because I didn't want to just disappear and not be somebody that people instantly recognised, but I just felt that it was quite fitting to keep the name Virgin because of the the lecturing that I do.
Very good. I know we spoke off camera earlier about leadership within the nursing group and leadership with about how you're going to help those junior nurses and nurses coming through. Tell us a little bit about, give some examples of leadership that you're experienced and have experienced in your career.
So now I'm the lead specialist nurse at the Chelsea and Westminster hospitals, which is a very large London trust, and I'm at the site over in Isleworth, which is the West Middlesex Hospital. We've got really strong nursing leadership within the trust, and our chief nurse actually was named in the NHS 70 recent celebrations as one of the most influential nurses of the last 70 years. And she also worked as a midwife at the West Mid, so she knows both trusts really well, both hospital sites really well. And to have a strong nursing leadership is really important. I can remember days in the past where actually they got rid of the director of nursing, and it was really difficult for a nursing voice to be heard at the hospital. So it's lovely to have such a strong nursing leader.
What do you define as strong leadership within that nursing community? Because leadership's such a wide, different people define leadership differently. But obviously with your role as a specialist nurse, with what you've done, your career, you've seen the good and the bad, but now you're saying this is strong leadership. What does that look like?
I think it's someone who's approachable. Okay. That's the big thing for me. Someone who's visible. And I actually, if I go round, considering we were merged a few years back, actually the chief nurse is on both sites a lot of the time, and also if I ask nurses on the ward if they'd recognise our chief nurse, they do. I think there's lots of recognition from the leadership in terms of awards for nursing staff, and what I love is they're quite active on Twitter, and they're active out blogging and out in the nursing press, and what they're doing is constantly saying the good things about what nursing brings. So they are recognising stuff that's happening within the trust. So I like the fact that they're approachable and recognisable, because I think that's part of the battle. The fact that people outside the trust recognise that you're a good leader also makes you feel that you work for a trust that has so much to offer. And in these days where there's issues with recruitment and retention, I think that's an important thing.
Massively.
So I've been really impressed actually with it's even the team that are beneath the chief nurse, so all of the directors of nursing fall into that same mould, and they're very good at listening to ideas. So if you bring something to the table that you will think will improve quality or patient care, actually that's encouraged. I'm at my site, the director of nursing is our Freedom to Speak Up champion, guardian, and I'm one of the champions, so I work quite closely with her, and I think it's really important that nurses have a voice, but that nurses speak up. And I know one of the questions that you were going to ask me was around what I would say to my younger self, and I thought a lot about that, and I think one of the things would be to always follow your instinct. So if you see something and you know it's not right, then actually don't sit back. It's to speak up and be counted. So I think always have a strong voice. They're the things, and I feel that actually within my trust I'm allowed to have that strong voice and it's listened to.
And how does that work for maybe junior nurses coming through or student nurses? Are there still those opportunities to make mistakes, ask those questions? Because sometimes you worry as a new person in a new job on a ward, you're scared.
You do. Yeah. It's recently been Freedom to Speak Up week. Okay. So we've done lots at the trust in terms of going around and getting out there, recording things for the intranet, explaining that actually everyone has a small chance to make a difference, and if you see something that you're not happy about, then there are lots of people at different levels you can actually go and speak to, because that's the concern, isn't it? If you're a student nurse and the person you need to speak to is the director of nursing, you doubt actually whether what you're looking at or what you're seeing is right. We know that what student nurses and newly qualified nurses also want is enhanced preceptorship, and we're doing a whole lot around that at the moment at the trust, because to retain nurses, to think about our workforce, and that's what we want, is we want a substantive, consistent workforce that is going to offer the best for our trust, then we need to make sure that they are supportive. And what they've been talking about wanting is they want a rotation, they want a supportive site where they've got not only fantastic leadership at the top, but in the area and the department that they work, they get good leadership. And we've actually appointed strong leaders within the ward sisters and the ward managers. They also have said that what they need is a variety of areas to work in so that they can actually develop their career path. So we do lots of rotation of our newly qualified nurses. We do resilience training. And we also do leadership training.
What does resilience training look like?
Now you're asking. So I know we offer it. I'm not sure actually how that runs out, but I know it's a course that people are really keen to get on, because I think that's the trouble, isn't it? It's easy to be worn down by the everyday situations that you find yourself in. And I think the leadership course actually gives them a voice where they feel they're listened to. And they understand that people want them to challenge thinking, challenge ideas.
Well, and obviously, as you mentioned, some of the challenges you touched on at the moment, especially in Norwich Hospital across the NHS. What are the biggest sort of challenges, maybe top 3 that you think we're facing at the moment from a nursing perspective?
I mean, I think workforce is a huge thing. I think we've got a huge number of nurses that leave the profession every year, and they're either leaving because of retirement, or they're leaving because it's not the chosen career path for them, or they're leaving to pursue opportunities abroad. And we know that we're in competition with a whole host of other countries. I think I was reading actually that last year or this year it's the first time that more people have left the profession than joined. So we know that there's an issue around numbers. And one of the things that I've kind of thought a lot about is the nursing associate role. Because in my day, we had a 2-tier nursing system. We had enrolled nurses and we had your state registered nurse. And both of them, within reason, worked really closely together and did very similar roles. But of course, in days gone by, they decided that that wasn't the way forward, and that what we were going to do was make everyone that was an enrolled nurse trained to be registered and build this strong working team. But now we're looking at potentially another 2-tier system. So in terms of the nursing associate, that could be seen as a negative.
Yeah, lots of people have different opinions on the nursing associate role.
I think that we need to see that as an opportunity. We are in a situation that we're in and we need to try and manage that. And I see lots of people that work on the wards that don't feel they've got what it takes to do a degree course. I see lots of healthcare assistants that I see a massive potential in terms of, they're fantastic with patients, they understand the requirements of supporting good nursing care, and I think it's an amazing stepping stone for people just like that to get into nursing and use it as a stepping stone to registration. I think the downside will be if number crunchers think that it's a cheaper way of getting nursing care. And so my concern is that if we just have one registered nurse and lots of nursing associates, that may not be the way forward. But if the structure is right and the skill mix is right, then I think it is a really fantastic opportunity for people to get into nursing.
Because obviously it's still quite a challenging course to get onto nursing, isn't it? From a degree perspective. And I suppose, one of the challenges that a lot of people highlight to us is the funding, the bursary. And that's maybe stopping more mature students sometimes going into that as a second profession, because reality, if you've got a family, you can't drop down to the kind of money that we're talking about and the costs essentially. But we see that's been one of the biggest challenges in England about people actually going into the profession.
Yeah, and there's no easy answer to that either, is there? No. That's the difficulty. It is. It's It is a real challenge. I see some amazing students. I was at the Fab Awards last week, and actually there was a student nurse that won an award. And I see fantastic student nurses every day, and they are the students of the future. But it is a challenge, isn't it? And they go into environments that were very different from when I trained. And there is that support there, and we've got some really fantastic, educational facilities. But I do worry about nursing of the future. Nursing's changed so much, and in my day, patients were in for so much longer. And in my day, when they used to ring me as a ward sister and say we've got someone who's 65, I'd be questioning why they're not going to a care of the elderly ward. Now we've got patients that we operate and do major cancer surgery on that are 92. And they come with a whole host of other issues when they're that old. So I think nurses of today are going to be looking after an elderly population, a population that has conditions such as dementia that bring real difficulty. I see on the wards, I see them trying to offer amazing care when they've got a patient on a surgical ward that is agitated and needs a special and is constantly roaming. I look and I think, it's such a difficult, albeit very rewarding profession, but actually some days are very challenging. The other thing I sort of consider about that, as well as in my day, we had very clear shifts. So actually you did 8 hours, and then after that you went away. You kind of sometimes did a bit more. And I think there's some real merits to that old kind of shift system. And for me, the biggest merit was about teaching. So in the afternoons, when the late shift and the early shift were both on the overlap, we would sit down at the table and do lots of teaching. There were lots of nurses around to be able to, give really good supported care. And when I was a ward sister of a 20-bedded ward, I would have 15 nurses on an early shift, and I had 8 nurses on a late. And it was a 20-bedded ward. Lots of those would be student nurses, but students always worked then with a qualified member of staff. We now have 60-bedded floors, but divided into 30-bedded units. Probably there are 4 or 5 qualified nurses on any given time, but patients are much sicker in my view. So I think there are challenges. I joke now when I talk to people, but when I was a ward sister, if our emergency day to take patients onto our ward was a Tuesday, and the previous Thursday somebody was fit and well and ready for discharge, we would have a conversation in the team and say, good, we'll keep them in and they can go home next Tuesday. And they can do the teas in the evening and they can go around and chat to the patients.
Different now.
It certainly is. And now, it's hot bedding, isn't it? A bed is empty for half an hour before there's pressure. So I do think the challenges are really different. I do think as a profession, though, and as a career role, it is just one of the best in the world. It is just such an amazing thing to be able to make such a difference, and I'm feeling really emotional just saying it, but to be able to be in people's lives at a time when they are most vulnerable and at a time when they're most scared, and to actually know that at that point you've made that difference. I know that you were going to ask about the challenges and the kind of really lovely things about the role that I do now. And the challenges for me in this kind of situation where the NHS has not got this pot of money that is forever there, is that as a nurse specialist, I'm forever having to, it feels like forever, but I am constantly having to justify my role, justify my grade. Now, I believe that nurses should have a voice. So I believe that we can't just expect our bosses and our managers and the people that work with us to understand what we do. You have to tell people. It's really important that everybody out there understands that as a nurse, what you bring to the table.
It's almost the brand, isn't it? The brand of being a nurse. I think we had someone before that said they always push back on people when someone goes, "I'm just a nurse," and they go, "No, you're not. You're a nurse."
You are.
And it's about sometimes bringing that brand to the to the forefront.
And it's funny you should use that word, because I'm on a project at the moment where we are trying to brand Stoma Care. Because we want to, our group, and we're hoping to launch something early next year at the Houses of Parliament, but we're hoping to demystify and make Stoma Care something that's less scary. But back to nursing, I just think that we should be writing annual reports. We should be demonstrating our added value to that patient journey. So I do believe that we should be doing that. What I find sometimes tedious is with changing management, with changing the NHS, that specialist nurses are called upon to justify what they bring, what they do, because they're quite a costly resource. And there's huge amounts of academic evidence out there as to exactly the benefits of what specialist nurses bring.
We had Victoria Cuthill on here before. Right. I don't know if you know Victoria, but she does genomics, and just talking about what the value they add. Yeah. And the value, talking about Stoma Care. Obviously, we had Dr. Terry Porritt on. You know Terry. What's the solution otherwise? Because otherwise, you haven't got enough doctors. Well, you haven't got enough. The reality is, we've got trained, brilliant nurses. Give them the opportunity to go specialist, and they'll help patients.
Yeah. I mean, there's been a whole lot of stuff looking at the value added that you bring that you can't quantify. So the trouble is I find people ring me about stuff that's maybe not specifically related to their cancer or specifically related to their stoma, but actually it's related to that situation they're in at that time. So they've tried to ring somewhere else and they're not getting any answer, and they're now worrying about when their CT and their MRI are. And because as a nurse specialist I give people time that other people probably aren't able to, and they know that we respond, so they ring me. So I go and broker appointments in X-ray. Now actually, if you look at that from a trust point of view, is that really that important? But from a patient point of view,
it's that patient-centred care, isn't it?
It's absolutely huge. What you don't want to be doing is sitting at home worrying about when you're next tested and how you get there. So actually there's a whole lot of that specialist nurses bring.
Well, I also notice that nurses, and I don't say this in general, but nurses have the softer skills. Yeah. Looking after the patient, but also we always notice that we always talk to nurses and they talk about talking to the families.
Absolutely.
It's those softer skills that nurses bring, that care, if you like, and they always seem to be looking at that care of the patient as opposed to maybe the medical. Sometimes it's that care of the patient, listening to the patient, listening to the family, so that when they are discharged, they're doing the right sort of things.
And I think that's the luxury. That's one of the really lovely things about my job, is I've got that time. I've got the time to be able to listen. And people tell you the most amazing things about their lives, but also about their fears. Certainly when you're looking at end of life care patients. And that's why I get emotional, because actually it is an amazing profession to be able to do. I was thinking about some of the highlights for me, and there was a patient for me fairly recently that I even used for my revalidation. So it was somebody that had a bowel cancer, and we'd done a permanent colostomy on, and he was a really lovely man in his sort of late 40s. Had a nice family, 2 kids, went to school, got on with his life and was doing brilliantly. And apart from all that initial care that I gave him, he was then back in charge of his life, and life was great. But unfortunately got recurrence. And he was at the end stage of his life, and he'd been admitted to one of our wards. Now I was at a stage in my nursing career where I was contemplating what to do. I had a colleague that had left. I was trying to cover the service on my own, and I didn't have a good work-life balance at the time. They were trying to recruit, but I was working silly hours, still there at 9 o'clock at night, wasn't seeing my family or my daughter. And I was really thinking, maybe after 37 years, the time has come for me. And there was a knock on my door late one night, and it was this patient's wife. And she just said, look, you might not remember me, but you were so amazing at the time, and he's in hospital, and I don't know what to do. And essentially, he'd developed a fistula. Now, a fistula is where an internal hole in the bowel develops, and so faeces finds its way out. And on this gentleman, the faeces was coming out from his spine, from halfway up the back of his spine. So although he had a stoma, because his cancer had created more problems, he had this fistula where faeces was coming out from his back. And she said, you know, he's on the ward, and the ward nurses are doing their very best to try and manage this, but actually the private little room that he's in, the side room that he's in, just smells awful constantly, and it's put him off of eating. He won't eat. I can't stay. I really want to be with him, and I want to stay, but I can't bear the smell, and we just don't know what to do. And the hospice won't take him because, you know, they can't manage this. And I really wanted to say, it's 9 o'clock at night. If I'm honest, I wanted to say, it's 9 o'clock at night, and I haven't seen my daughter all week because she's been in bed when I've got in from work. But I said to her, look, go up to the ward and I'll come up. I'll think it through and I'll come up. And I went up and probably spent about an hour with this lovely gentleman, and I was thinking outside the box, which is what my skills allow me to do, and I was able to actually put a wound management kind of Stoma Care bag on his back. Because what they were doing was they were managing this with just a pad, and of course the pad would then get soiled and sit against the skin, so his skin was compromised, he couldn't lay comfortably. It was just a whole host of awfulness for him, really. And then the next day she actually came down about 12 o'clock with a really lovely gift and said, it's just transformed. It's just transformed him. There's no smell in the room, he's eating. I stayed last night, and actually he went off to the hospice, I think 24 hours later, because they then agreed to accept him, and he died within 48 hours. And it really made me, and I am emotional about that now, because it made me sit back and think, wow, that's really powerful to be able to do something for somebody that was in such a desperate situation. And where I was really close to thinking, maybe I've been doing this too long, it gave me that vigour to think, that's why I do it. That is why. So that's why I'm still passionate about it today. And you cannot beat that feeling. And you have little bits of that feeling every day in nursing. But you do, you know, and that's why it's such an amazing, with all its challenges and with all its difficulties, it is just such an amazing job to do.
We talk about mental health quite a bit. You know, it's kind of a big subject these days. What examples do you sort of see of mental health for our nurses, our caregivers? Or the challenges, because they're under more pressure than ever.
Yeah.
Hours being worked there longer, as we've said.
They are.
They're, you know, sometimes seen as infallible in the medical industry. You can't make mistakes. Obviously, everyone does. We're just human. You know, everyone goes to do a good job. What sort of things are you seeing around that for our actual nurses?
I still see really fantastic ward camaraderie.
Yeah.
You know, and I was worried that we would lose that, because I know I revert back to the old days, but in the old days it was tough, but there was loads of laughing going on. There was lots of fun. But of course I don't see quite so much of that now. I see hugely professional nurses, but I don't see much downtime. They do 12-hour shifts, which I think for me...
3 12s, isn't it?
Yeah, and for me I see that as kind of almost impossible. How do you not flag at some point in the day? How do you keep that fantastic disposition? So I do see really good support from the team, and I think that even with our junior doctors, you know, I am there role modelling and saying, I think you need to take some time out. So I've said to doctors and nurses, you know, why don't let's just go and make a coffee, take some time out, let's discuss, you know, what's challenging at the moment. We have from the ward, they also offer kind of sessions monthly where they do sit down and talk about difficult patients that they've looked after. And if it's a patient that a specialist nurse has been involved in, we're encouraged to go along, think about why there were those challenges. I go, and I will refer that back to our nursing team, but I go for clinical supervision. Now, clinical supervision was something that was, all over the nursing press some years back, 10 years back, and it was something that wards were going to develop. So we do have a structure, certainly on the West Mid site of our trust, whereby clinical supervision is offered. My supervision, I'm in a luxurious position where that's kind of sponsored by a company. So I actually go out and see an external counsellor, and I see him every 6 weeks. And even when I think I've got nothing to speak about, I spend 2 hours of speaking about patient care. Sometimes I speak about things that are happening at home, because that also affects how you can do your job. So that's the kind of model that we've tried to use. So I offer supervision to some ward sisters. At one stage we tried to do that on a collective thing, but it didn't work. All that I found we had when we had a collection of ward sisters was people really kind of just saying, that's happened to me, this is how I dealt with that. And although that's a really useful forum, you can do that within a unit meeting. So I actually do offer clinical supervision to ward sisters. I also am there offering mentorship to a matron, so a new matron that's in role. So I think they're ways of being able to offer people's support with mental health, with recognising that actually it is a difficult job, and that if they need support, it's there. I think it's about being kind. One of our trust things is to be unfailingly kind, and I think that as well as being kind to patients, we need to be kind to each other. Because what I notice is that sometimes it's easy within a hospital to work in isolation of other departments. So you're frustrated because someone's not been to collect your patient to take them off for an x-ray, or you've had 4 phone calls now from A&E about why the bed's not ready. So when they bring the patient up, it would be easy to see nurses arguing about, well, I haven't got a bed for this patient yet, forgetting that there's a patient there waiting. So actually we recognise that, and I do see that, we're encouraging people to be kind to each other within other departments. And overall, I think that that's one of the ways in which we're supporting each other's mental health. I think there are really challenging patients, and sometimes you do need to actually say it's fine. I've had challenging patients, and I've actually said to patients, I'm finding, your behaviour really challenging. And you don't just have to put up with all of that. No. So by having a policy as well where people can't just treat you badly, a red card policy where they actually will say, we won't accept this behaviour against or towards our staff. The challenges, I think, as well, for me, I have this kind of debate with myself, because we have homeless people that come in. And of course, in my day, you actually sorted homeless people out by finding them somewhere to live. And that doesn't happen anymore. How do you sort people out so that they're medically fit, knowing that you're going to discharge them?
That's right. The same problem, isn't it? Yeah, they talk about the social care policy versus the, getting it together. I know Manchester have got that as one budget now to make sure it actually follows the evolution, I think it is, isn't it?
Incredible stuff, isn't it? When I think about how nursing is going to change, I think that a lot of the medical conditions that we now look at are the health-related issues of bad choices, of lifestyle.
Yeah, diabetes, they talk about it's going to go through the roof.
It is. And I think, all of those things we should actually be really proactive about. So I see nursing going much more towards health promotion. And we've touched on it in the past, but I think that there will be a huge push in dementia care and a huge push in, proactive management of lifestyle choices, so that we're not then trying to play catch up and deal with.
So look at the wellness prevention before actually having to deal with the hospital.
I think that's where nursing will go.
And what do you think the main trends are for 2018, 2019 in nursing?
So I think it will be looking at the nurse associate role. I also think there's a huge I say push, I mean it in a really positive way, within technology. And that's really exciting. I see that as hugely exciting within medicine.
Is this the digital nurse that people keep talking to me about?
Well, I think things that support nursing more. I know that we've got a huge innovation team within the trust, so we've looked at all sorts of projects recently, and I've been involved in a project where we're trying to empower patients to take on more of their care, and to, I was looking the other day, I was reading about the diabetes gadget that the Prime Minister wears, and I was looking at how that helps diabetics to manage their condition much better, so that actually when they have huge lifts in their blood sugars, knowing when that time of the day is, so that they're eating correctly or exercising correctly to prevent that. So in the same way, we've been looking at that within Stoma Care, and we looked at a device that actually fitted onto the outside of a patient's bag, so that they could recognise what the consistency of their stool was, whether they were going to become dehydrated. There was a whole host of things. It was a bit like a Fitbit.
Yeah, I think someone was telling me as well they do like a call centre where they'd ring you and go, "Are you okay today? Is everything all right?" But in the diabetes area,
Yeah,
they have like big call centres where they'd ring you.
So you can actually, the idea is that we would be able to, in hospital, monitor that information, so that if we were concerned, because one of the problems you can get with an ileostomy, a small bowel stoma, is that you can get dehydrated and get readmitted with an acute kidney injury. And you see that in elderly patients when they might get a urinary tract infection and they don't drink enough, or they don't eat, and then they get a really watery output. And what nurse specialists are really good at is preventing admission to hospital. So this device actually allowed us to monitor whether patients were potentially at risk of that, from a dashboard on our computer. So that was a great project to be involved in.
The readmission rates, yeah, that's the big thing they're measuring on it.
Absolutely. If you can keep people in the community well, that's better.
Yeah.
So we are, at the moment, we're not quite doing it, but we're just about to start another project whereby we will use an app that actually puts patients back in charge of their condition and their disease. So that's an exciting thing that we're about to do. So I see that nurses can become involved in looking at healthcare in the future. I was talking to somebody that works at Microsoft, and they were talking about artificial intelligence within medicine and nursing, and they're developing all sorts of things. So he was telling me about virtual reality glasses, that when you've got these virtual reality glasses on, you can see inside the patient. So there'll be an app for that, and he said you can see the heart beating, and I just thought it's incredible in the way in which we can go, and nurses need to keep up with that.
No, massively. I think I was hearing about in Australia where you can have a PIN,
Right.
almost like a bank card,
Yeah.
and you'd have a PIN, and that'd have all your patient records on.
Yeah.
So you literally walk into your doctor's, put your PIN in,
Yeah.
and then you're responsible for your patient record. So it just comes up, and you've got it all in the banking system. Moving that into the healthcare system would,
It would be. And I
it'd save fortunes.
Absolutely. And I think, we are all going electronic. We've recently got a new system. So I'd like to think that will really help cut down on the paperwork. And, and certainly if we can manage to get voice recognition for entry of notes, because you're always going to need excellent record keeping, aren't you?
Yeah, of course you are. I think it's about, as you say, not batches of paper that no one reads.
No.
You want it as something that's easy to read, quick to put on, and if you can speak the notes instead of writing them, you can spend your time actually going into looking after patients as opposed to doing admin. And what do you sort of think the future looks like for nurses?
I don't think it will change. I don't think it will change that much. I'm sure it will in lots of ways. I do see that we've got a stronger voice.
We hope so.
Yeah. We can see that because of, there were recently issues with the Royal College of Nursing and people being advised about something that they didn't feel fully informed on. And of course, there's been huge changes at the RCN since that. And they've always
we wish Donna Canay the best.
We do. They've always said, haven't they, that if we all spoke with one voice, we'd be a really powerful team.
Very powerful.
And I think in the old days, that was recognised but not actually acted on. Whereas now I look out there and see lots of powerful voices in nursing. Alison Leary in education and nursing and research. Terry Porritt, you know, looking at all sorts of ways of giving nurses a voice. Projects such as this. The Fab Awards, you know, which are a really lovely award recognising all of the good that's done out there, but sharing, you know, and I think that's the thing, if we actually share best practice instead of reinventing the wheel. So I think technology will make the biggest difference to nursing.
But sharing that best practice is a big thing, isn't it? Because, you know, you're doing certain things in specialist areas, or even just clever things. I remember Terry telling us a story about, for dementia patients, a nurse had come up with putting the stars on the ceiling, which they did for their child to get to the toilet at night. So then a dementia patient can see that, because the colours, I don't know the ins and outs, and they could go to the toilet. But it was just a very simple thing. But then it was like, wait a minute, let's share that around.
And that's the whole thing about the Fab Awards, is they're quite small initiatives, really small things that make a huge difference. You know, and fundamentally, that's what we're there for, aren't we? We're there to serve our patient, our public.
It's just sharing those ideas. You know, you got that great innovation that might happen in one hospital somewhere. It's like, wait a minute, you could use that everywhere, and they, you know, they don't cost a great amount, but they make a big difference, as you say.
And that's where the Academy of Fab staff is brilliant, and it's taken a really short space of time to actually get people on board. And there are so many people that are entering great things, but not only entering stuff that they do, giving feedback and there's reviews.
Yeah, I think Roy Lilly's saying they're 3 million hits a week or something ridiculous now. He just said he's gone through the roof, but it was only done as something that said it was a speech he did, and someone said you should share that Fab stuff, and then he ended up, you know, bringing this to the table.
And I think that NHS England were trying to do something very similar. And NHS England had a whole team for this innovation and looking at ways in which we could share best practice, but got very few hits on that website. But because of the approach of Roy and Terry, and because of, you know, they're very charismatic people.
And they got the ambassadors as well. They're a good group.
It's actually really taken off, which I'm delighted about, because when you read them, they're the simple ideas that make such a big difference.
Exactly. Yeah, no, Roy starts going about NHSD, NHSI, NHSE, and he goes NHS die, and I'm like, okay, Roy.
That's the reality, isn't it? They're not very costly either. No. These things are money-saving ideas. They save bed days, some of them. Small things, they're not silly, small things like changing the colour of Zimmer frames for dementia patients.
Red and blue, isn't it? So you can recognise it, so they don't fall over, they don't have as many falls, and they don't stay in hospital as long.
That's right. That's the colour that they recognise. There's things from welcome packs, there's loads around end-of-life care, loads. And it's that, and I've forgotten the name now. How can I have forgotten the name? There's another one, and there's another website for specialist nurses that Terry's been involved in.
Apollo. And that gives us things around business planning and how you plan your budgets, because you're showing that additional skills that you may not be trained on as a nurse. Yeah.
So Apollo Nursing, that Terry Porritt was instrumental in setting up, is a fantastic website for any nurses, really, because although it was initially for specialist nurses and it was there as a lone nurse for you to be able to go out and sell your service, it offers skills in leadership, it offers skills that will be needed by any nurses that are going along that career pathway into professional leadership. So it's a fantastic website.
And that's a great website. You know, where are you going to learn that stuff?
Absolutely. There's huge amounts of templates as well. Yeah, so again, not reinventing the wheel. It's about saying somebody else has done this, looked at a patient pathway, done a job plan. I do think that we should be demonstrating our worth, and that, in a way, if I wanted nurses to do anything, all nurses at all levels, it's to shout about what you do. and I think we have got better, but I still think there's a long way to go. When it was National Nurses Day, it's always the likes of me or people at the trust that speak up, but we need new nurses, we need student nurses, which is why it was so lovely to see the student nurse win an award at FAB for something that she felt was really worth doing. So lovely.
Tracey, I could sit here and talk to you all day, but we're going to have to finish it up. Is there any message you'd like to give to our nurses to finish off with?
You do an amazing, fantastic job every day, and even though sometimes it's difficult and sometimes you feel you can't go on, something in every day will happen that makes you realise that it's the best profession in the world.
Thank you, Tracey.
Thank you.
Thank you for watching The Voice of Nursing. Thank you to all our nurses, healthcare assistants, doctors and support workers for looking after us all. We'll catch up with you again soon.